Exactly what does Medicare cover? Now, this is a topic that is confusing for most of us and frustrating. People often ask us, does Medicare cover this, or does Medicare cover that, or I'm going to have this procedure done. Will Medicare cover it? What we share with them when they call us is that there's an easy way to know what Medicare will cover without hypothesizing all the medical procedures that you might need over your lifetime. In this video, I will go over that easy way to remember what Medicare will or will not cover, and also show you how you can get coverage for those things that Medicare does not cover. By the end of this video, not only will you be the smartest person in the room when it comes to Medicare coverage, but if you have an Advantage plan and are denied coverage, you will know whether it's a legitimate denial or one that you can easily appeal. To make this video easy to follow, I'm going to break it down into two main categories. The first part is what is not covered by either original Medicare with or without a supplement or an Advantage plan. The second part will briefly look at some of the weaknesses and gaps in both Advantage plans and original Medicare that can be easily patched. In both sections, I will show you the additional coverage that you can get to cover those gaps so that you'll never face a frighteningly large medical bill. Also, there will be a menu system in the show notes so that you can easily navigate to whatever piques your interest the most, and you'll be able to access it here down below. What makes this specific video format so useful is that it's ideal for two groups of people. First, those who are comparing the benefits of an Advantage plan to the benefits of original Medicare. And second, those who are considering moving to an Advantage plan from original Medicare with or without a supplement to lower their monthly premiums. Many newer agents lead people to believe that Advantage plans offer the same benefits as original Medicare plus a supplement. Now, as you'll see in this video, that is not true, but it's a common misconception that's prevalent, and it's often encouraged by the insurance companies that benefit most from Advantage plans. In fact, if you have heard from an agent that Advantage plans are the same benefits or more benefits than a supplement, please let me know in the comments below. I'm going to bet your comments will trigger some very interesting and useful discussions. So stay tuned. If we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. We are one of the country's premier insurance agencies specializing in Medicare. In fact, I'm licensed in every state except Massachusetts. Sorry, Massachusetts. And our services are free to you, the consumer. So reach out to us for expert guidance. You'll be glad you did. If you learned from this video and you want to see more of my content on Medicare, please press the like button below and subscribe. Also, select the bell icon so you're notified when new videos are published. If you're already a subscriber, please check that bell icon. We've noticed that many subscribers are not being notified when new videos are posted and their bell icon was actually turned off. Anyway, let's get started. The easy way to understand what Medicare will not cover is to understand Medicare's mandate for what they are required to cover. If you've looked at the most recent copy of the Medicare and You guidebook, you'll find one specific term that they repeat a lot. The term is medically necessary. In fact, the term medically necessary is found 32 times in the most recent Medicare and You guidebook. So Medicare's mandate is to cover everything that's medically necessary. Now that seems simple, but what exactly does that mean, medically necessary? Medically necessary is defined as healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms, and that meet accepted standards of medicine. Let me repeat that. Medicare will cover anything that is medically necessary, and medically necessary is defined as healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms, and that meets the accepted standards of medicine. So why isn't corrective vision treatment covered by Medicare? Because corrective vision is not a disease or a medical condition. But that is why Medicare will cover glaucoma, macular degeneration, or cataracts and retinopathy, or any of the dozens of other eye diseases and conditions. This is also why when people ask me, will Medicare cover X procedure? My response is to ask why. Why do you need this procedure? If the procedure is needed to treat or diagnose a disease or condition, an illness or injury, then yes, Medicare will very likely cover it. Make sense so far? Let me know in the comments below if that explanation helped you to understand Medicare a little bit better. Of course, there are always exceptions and quirks, is the best way I can describe it, but the exceptions are few. This also means that if you have an Advantage plan and the insurance company denies coverage for something that you need, ask the doctor if the procedure they're prescribing fits the description of medically necessary that I just covered. If so, then the Advantage plan is supposed to cover it, and you should most certainly appeal. For your information, according to the Health and Human Services Inspector General's Office report, more than 80% of appeals to an Advantage plan are successful on the first try, but only 1% of the people who have been denied coverage even try to appeal. So next, let's look at what is not covered regardless of how you're getting your Medicare. So number 1 on this list is long-term care. I'm curious if you've heard of the term that's become unfortunately mainstream. The term is Medicaid divorce. It's the result of one spouse having long-term care needs, but no long-term care insurance. If you have the need for long-term care and are not insured, the cost will very likely drive you into poverty. At that point, your only option for continuing care is Medicaid. Not great quality care, but it's better than nothing. To qualify for Medicaid, you need to be at or below the poverty level with almost no assets. The bottom line is people are getting divorced to protect their spouse from becoming impoverished. Medicaid divorce. It would be better to have insurance. What exactly is long-term care? Long-term care refers to a range of services and supports that help you perform everyday activities. Long-term care can be provided in your home, and a nursing home, an assisted living facility or another setting, and may include medical care, therapy, 24-hour care, personal care, and custodial care, which is homemaker services. The key term in the definition is to perform everyday tasks. It's also referred to as activities of daily living. Activities of daily living include bathing or showering, getting in and out of bed or a chair, dressing, walking, eating, and using a toilet. Usually, when you cannot do 2 of those 6 activities of daily living, you need and qualify for long-term care. So how do you get coverage for long-term care? Well, there are 3 ways. There is long-term care insurance with a monthly premium, which can be very expensive if you wait until your medical years to consider it, or asset-based long-term care, where you put up a sum of money, maybe one lump sum or over a fixed amount of time, and in general, buy an annuity that pays long-term care benefits. Some people use retirement funds, qualified funds, to purchase a long-term care policy, which is a great option if you have more retirement funds than you need, but no long-term care. A less expensive but still costly option is to buy a newer type of life insurance that offers living benefits or long-term care as a rider. Living benefits is a feature that lets you access your death benefit early while you're still alive. It's often referred to as an accelerated death benefit. So early access to the death benefit usually requires a critical illness like cancer or a chronic illness where you cannot perform at least 2 of the activities of daily living. The third way and lowest cost option and least coverage is similar to long-term care in the benefits it provides, but it's not long-term care. It's called a recovery care policy. A recovery care policy is an indemnity policy. And that means that it pays you the benefit directly, not the medical provider. That also means it can be used in addition to other insurance. That's important. The maximum amount of time the recovery care policy will pay a benefit is 360 days. Thus, it is not long-term care. But it can buy you time, and be used to lower your long-term care premium by designing your long-term care policy to include a 1-year waiting period. In that case, when your recovery care policy runs out at day 361, your long-term care policy begins its benefits. The recovery care policy requires you to be unable to perform at least 2 of the activities of daily living before it will pay benefits. It can then provide you a cash benefit for skilled nursing care, intermediate or custodial care, or assisted living, or even home health care. So recovery care is a great value that can be used on its own or use it to lower your long-term care premiums, as I'd mentioned. Because recovery care provides many of the same benefits as long-term care, but only lasts 1 year, you can have a 1-year waiting period on your long-term care policy and significantly lower those insurance premiums. Now, let me know if you have heard of the term Medicaid divorce. Please let me know in the comments below. It's a topic that really needs to be brought to the forefront. So our healthcare system doesn't have to be this way, and I'm interested in reading what you have to say. All right, next, number 2 on what is not covered by either original Medicare, plus or minus a supplement, or an Advantage plan, is international insurance. Medicare is active in the United States and its territories, not internationally. That said, all the most popular Medicare supplement plans do have some coverage if you're traveling internationally and not outside the country for more than 60 days. That's the Medicare supplement plans, not Medicare. And this includes Medicare Supplement Plan G, Plan F, and Plan N. And they will pay 80% of your emergency or urgent care bills up to a lifetime maximum of $50,000 after a $250 deductible. Some Medicare Advantage plans have similar international coverage of emergency or urgent care while traveling overseas. Now, this is important. Please understand, none of these policies will cover you for long-term travel or if you decide to become an expat. Of course, we recommend people get at least some healthcare insurance for traveling. Private healthcare insurance is also available for expats or long-term care travelers through my website. You can get quotes for travel health insurance coverage on my website. Just choose the drop-down menu under quotes and then travel insurance. Now, this is an affiliate link to an independent travel insurance brokerage that I use that shops your needs among the top insurance carriers. All right, next, let's look at what might be covered by Advantage plans, at least to some degree, but not covered by original Medicare. This is not to say that Advantage plans have more benefits than original Medicare. The first subject on this of what Advantage plans cover better is preventive care. Both original Medicare and Advantage plans offer preventive care that's free to the patient. But original Medicare's preventive care is weak, to say the least. Most Advantage plans offer an annual physical for preventive care. Some are quite extensive and cover a lot of tests. Original Medicare's preventive care is called a wellness visit, an annual wellness visit. They're not a physical. And they can include some blood work. Some tests can be done annually, some only every 5 years. Most people are disappointed in how limited preventive care is with original Medicare. In general, Advantage plan physicals are more in line with what most of us expect an annual preventive care physical to be. I have, fortunately, found a way around this weakness in original Medicare. There's one A-rated Medicare supplement insurance company that we work with that will pay all of your preventive care, even if it's not covered by original Medicare. That means that with this one supplement company, you can get back to having thorough and comprehensive preventive care without paying for it. As a supplement, this has a slightly higher premium than many of the companies that we work with, but personally, I believe it's 100% worth it. So if this interests you, reach out to us and we can get you the details. The second service, better covered by an Advantage plan than original Medicare, is dental coverage, dental, vision, and hearing care. So typically the DVH coverage by an Advantage plan is inferior to having your own DVH policy. Advantage plans often, not always, but often have minimal coverage, just so they can say they offer dental as a marketing ploy. The really big weakness of Advantage Plan dental coverage is that you don't own it. That means that the benefits can change annually. And as costs go up for healthcare, Advantage plans tend to reduce benefits. If you own your own DVH plan, the benefits will not change and the costs seldom do. Most of our clients with Original Medicare add a standalone dental or DVH plan that they own whose benefits do not change. And we offer many standalone DVH plans that have substantially better benefits than the dental benefits offered by any Advantage plan that I've seen. And these are very reasonable price, and best of all, this would be your policy. You own it, no matter what else you do with your Medicare. Your benefits for this DVH policy will not change from year to year. So last and most interesting topic that we're going to cover will be a direct comparison between the benefits of an Advantage plan versus Original Medicare plus a supplement. We will start with comparing the Medicare Part A hospital inpatient benefits. Because Advantage plans are required to be comparable to Original Medicare without a supplement, Medicare Advantage plans will typically have a deductible similar in scope to Original Medicare with no supplement. Currently, the Original Medicare Part A inpatient deductible is just over $1,600. That means one night as an inpatient and you're charged just over $1,600. Advantage plans usually have a per day or per night charge up to approximately the same amount. For example, they may have a $500 per day charge for the first 3 days and then full coverage the rest of the year, or a $250 per night charge for the first 7 nights, and so on. Keep in mind, there are nearly 4,000 different Advantage plans, all with different cost structures, so check the specific plan that you're considering very carefully. With the Advantage plan, after the deductible, you're covered at 100% for the rest of the year. With Original Medicare, after the deductible, there is no cost for up to 60 consecutive days. And then there's a per day charge, and after 150 days, you have no coverage. But with any of the most popular Medicare supplements, the supplement pays all the deductibles and copays, all of them. Only if you have a high deductible plan or a Plan K or the Medicare Supplement Plan L will you have any inpatient Medicare charges. We will go over how to plug that Part A deductible hole in your Advantage plan in Original Medicare without a supplement in just a moment. But first, let's look at the next 2 weaknesses of an Advantage plan. The next weakness has to do with cancer care. All the Advantage plans that I've seen simply cover 80% of your cancer care, and that includes in-house chemotherapy, radiation treatment, and so on. And that is the same if you have just Original Medicare and no supplement. Medicare pays 80%, you pay 20%. The difference with the Advantage plan is that it has a maximum out of pocket. Original Medicare all by itself does not. So if you have an Advantage plan with a maximum out of pocket of $7,000, you can rest assured you're going to reach that maximum out of pocket in your first month or second month of cancer treatment. Now compare this to Medicare with a supplement, a Plan G or a Plan N, which pays virtually all of these costs. You may end up paying the annual Part B deductible, which is less than $300. And if you have a Plan N, you might be paying $20 office visits as well. But you will not pay the thousands of dollars that you would pay with an Advantage plan or without a supplement. If you cannot get a supplement, but you want to cover some of these expenses that you're vulnerable to with just an Advantage plan or just Original Medicare, I suggest investing in a hospital indemnity or critical care chronic illness indemnity plan. Indemnity plans, as I mentioned earlier, they pay you directly, and many are very flexible. So as an example would be if your Advantage plan has a $200 per day deductible up for the first 7 days, you can set up an indemnity plan to pay you $200 a day for the first 7 days when you're hospitalized, and maybe add a $20,000, $25,000 cash benefit if you're diagnosed with cancer. There are a lot of options, a lot you can do with an indemnity plan, and we can help you design one to fill the gaps of your specific situation so that you're not risking any large medical bills and at the same time keeping your premium very low. The next weakness of an Advantage plan relative to a supplement is in how it fails to fully pay your Medicare Part B medications. Now, if you are an outpatient and you're administered a medication by a medical professional at a medical facility, that medication is usually covered by Medicare Part B outpatient services. And this can include arthritis infusions, chemotherapy infusions, some osteoporosis treatments, and so on. Both Advantage plans and Original Medicare pay 80%, no more. You pay 20%. And these can be very expensive medications. However, the most popular Medicare supplements pay that 20% gap for you, no questions asked. Lastly, we can't discuss the differences between Advantage plans and Original Medicare Plus a supplement without stressing that the Advantage plan replaces Original Medicare. In its stead, your healthcare decisions are controlled by the insurance company administering your plan. That insurance company determines what is or is not covered and which medical providers you can see. They require your doctor to submit a pre-authorization request before any non-urgent procedures. That pre-authorization has to be approved. But then that can result in your being denied coverage or your procedures are modified from what your doctor recommends to lower the cost to the insurance company. Now, this has been a long video, but now you know what Medicare covers, what is not covered, and importantly, how you can improve your insurance coverage with policies that build on your Medicare or cover the gaps in your Advantage plan. So please, don't forget to subscribe to this video channel and reach out to us if you'd like a personalized recommendation based on your situation. And let me know what was your favorite part of this video. What did you get the most out of? Thank you. I'm Matthew Clausen at MedigapSeminars.org. Thank you for watching.